The bones of the thorax are the thoracic vertebrae, the 12 pairs of ribs, and the sternum. Connecting the upper 10 pairs of ribs to the sternum are the costal cartilages. The first rib is quite small. Like all the ribs, it's angled downward from back to front. We'll take a special look at the first rib in a little while. From the first rib to the third, the thorax widens in the shape of a dome to about 2/3 of its full width. From the third rib to the seventh, the thorax widens a little further in the shape of a cone. From the seventh rib to the 12th, the thorax narrows slightly and the ribs become very much shorter. The costal cartilages form a series of flexible, springy links between the ribs and the sternum. The first costal cartilage articulates with the manubrium. The second one articulates with the joint between the manubrium and the body, and the third to the 6th or 7th costal cartilages articulate with the body. Here's what the costal cartilages look like in the living body. They're quite flexible. These are the costochondral junctions, where the cartilages join the ribs. The lowest 4 costal cartilages, the 7th, 8th, 9th, and 10th, join onto one another in series, forming the costal arch. The angle between the 2 costal arches is called the infrasternal angle. The xiphoid process projects downwards in the infrasternal angle, where it can easily be palpated. The 11th and 12th ribs aren't attached to the costal arch. Since they're not linked to the sternum, they're called floating ribs. The ribs, sternum, and costal cartilages form an expandable container for the lungs and heart. This large opening, formed on each side by the costal arch and the last 2 ribs, is called the inferior or lower thoracic aperture. It's almost completely filled in by the diaphragm, which separates the thorax from the abdomen. The much smaller opening above, that's formed by the manubrium, the first ribs, and the first thoracic vertebra, is called the superior or upper thoracic aperture. The sternum, commonly known as the breastbone, consists of 3 parts: the manubrium, the body, and the xiphoid process, or xiphisternum. The manubrium is attached to the body of the sternum by a cartilaginous joint, at which a little movement is possible. There's a slight angle between the manubrium and the body, the sternal angle, that's easy to palpate, as is the upper border of the manubrium. Here's the clavicle, or collarbone. Here's the scapula, or shoulder blade. These 2 bones articulate with the bones of the thorax at one point only, here. The medial end of the clavicle articulates with the highest point on the manubrium, forming the sternoclavicular joint. It's easy to palpate the clavicle. Here's its medial end. The first rib is difficult to palpate. That's because it lies both below and behind the clavicle, and also because there's a thick layer of muscle in front of it. Now that we've looked at the thorax as a whole, let's take a look at a typical rib, the 6th rib. The rib is thin and flat and curved in the form of a spiral. At the back, there are 2 thickenings, the head and the tubercle, which are separated by the neck. The curvature of the rib is interrupted by this angle, which marks the insertion of the iliocostalis, a back muscle that we've seen already. At the front, the end of the rib is hollowed out, for the attachment of the costal cartilage. The outer aspect of the rib is smoothly curved. Its inner aspect is marked on the underside by this groove in which the intercostal vessels and nerve run. The head of the rib has two articular facets. The two facets articulate with the vertebral bodies above and below to form the costovertebral joint. This surface on the tubercle of the rib articulates with the tip of the transverse process to form the costotransverse joint. These two joints are synovial joints. They permit the movements of the rib that occur in respiration. The first rib is the most tightly curved of all the ribs. It's also the broadest of the ribs. When seen from the side, its upper border lies in a plane that's about 30 degrees from the horizontal. In addition, when seen from in front, its flat upper surface slopes downwards, also at about 30 degrees. The costal cartilage of the first rib articulates with the manubrium of the sternum, not at the top, but lower down, at its broadest part. The first costal cartilage is short and massive. It hardly permits any movement, so the two first ribs, together with the manubrium, move up and down together as one solid arch. Here's the vertebral column. It consists of 24 separate vertebrae, the sacrum, and the coccyx. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The sacrum consists of 5 vertebral segments fused together. The coccyx, or vestigial tail, consists of 3 or 4 tiny segments. The highest cervical vertebra articulates with the skull. The thoracic vertebrae articulate with the ribs, and the sacrum articulates with the 2 innominate bones to form the pelvis. When seen from in front, the spine appears straight. But when we look at it from the side, we see that it's markedly curved. The lower cervical vertebrae form a forward curve, the thoracic vertebrae form a backward curve, the lumbar vertebrae curve forward again, and the sacrum curves sharply backward. These pieces of material represent the intervertebral discs, which we'll be looking at shortly. There are marked differences between vertebrae of different regions, but they all have some basic features in common. Here's a typical cervical vertebra, the 4th one. The body is small. The upper surface of the body is curved, somewhat in the shape of a saddle. The lower surface has the same curvature in reverse. The vertebral foramen is large and triangular. The neural arch is formed mainly by the 2 straight laminae. The pedicles are very short. The spinous process is short and ends in a double point. The upper articular facets face upward and inward. The lower ones face downward and forward. The mass of bone between the articular facets is called the articular pillar. The transverse processes arise from the side of the body and also from here on the articular pillar. The transverse process of a cervical vertebra has a hole in it, the transverse foramen, through which the vertebral artery passes. The transverse process is shaped like a gutter, pointing downwards. It ends in two tubercles, an anterior and a posterior, where the scalene muscles attach. We'll look at a typical thoracic vertebra to see what these features are. In front, this cylindrical mass of bone, the body of the vertebra, supports the weight of everything that's above it. Behind, there's a set of bony plates and projections which serve three functions: to protect the spinal cord, to give attachment to muscles and ligaments, and to articulate with the adjoining vertebrae. This arch of bone, the neural arch, encloses the spinal cord. The space that's surrounded by the arch and the back of the body is called the vertebral foramen. The series of vertebral foramina create the tubular space that contains the spinal cord. The space is called the vertebral canal. This part of the neural arch is called the lamina. This part is the pedicle. There's a small notch in the upper edge of the pedicle and a larger notch in the lower edge. Together, the notches above and below form this opening on each side, the intervertebral foramen. A spinal nerve emerges through each intervertebral foramen. Arising from the neural arch are three large bony projections called processes: a spinous process in the midline, a transverse process on each side. Also arising from the neural arch are four articular processes, two above and two below. The lower ones face forward, the upper ones face backward. The articular processes of adjoining vertebrae interlock, forming a pair of synovial joints which permit movement between adjoining vertebrae. The bodies of the thoracic vertebrae become progressively more massive from above down, as they do from the top to the bottom of the vertebral column. Each of the thoracic vertebrae articulates with a pair of ribs. On each side, the vertebra articulates with the rib at 2 points. Here, at the end of the transverse process, and here, where the pedicle meets the body. We'll be looking at the ribs in the second section of this tape. The transverse processes of the thoracic vertebrae point sideways. The spinous processes point downwards, each one overlapping the one below. The articular processes are almost vertical. The upper ones face almost straight backwards, the lower ones face forwards. The body is massive. The transverse processes are small. The spinous process is broad and points almost straight backwards. The upper articular processes of lumbar vertebrae face inward. The lower ones face outward. Because of this arrangement, there's almost no rotation between lumbar vertebrae. The movements that can occur in the lumbar spine are flexion, extension, and lateral flexion to either side. Here's the sacrum, together with the coccyx. The sacrum is formed by 5 vertebrae fused together. From top to bottom, it has a marked backward curve. When we're standing upright, the sacrum is oriented just as we see it here. The upper part of this backward-facing dorsal surface is angled at about 45 degrees to the vertical. The upper part of this forward-facing pelvic surface is more nearly horizontal than vertical. On the dorsal surface, there are 2 articular processes for the 5th lumbar vertebra. The lowest intervertebral disc is quite wedge-shaped. Its shape accounts in part for the very marked curvature of the spine between the 4th lumbar vertebra and the sacrum. The most anterior point on the sacrum is called the sacral promontory. The vertebral canal continues down the back of the sacrum. From within the vertebral canal, the anterior rami of the spinal nerves, S1 to S4, emerge from these pelvic sacral foramina. The posterior rami emerge from these dorsal sacral foramina. The vertebral canal ends at this opening, the sacral hiatus, that's shaped like an upside-down V. This curved auricular surface articulates on each side with the upper part of the innominate bone or hip bone to form the pelvis. The joints between the sacrum and the hip bones are the sacroiliac joints. These joints permit almost no movement. The broad ridge on each hip bone adjoining the sacrum is the iliac crest. It's an important muscle attachment, as we'll see shortly.